Who's there? Who's there? Who's there? I'm cold. The AC is too strong. The AC is too strong. I don't think a grandma on a pigeon. So I'm streaming on both Facebook and YouTube. Hi, Baronet. Welcome to my life. Hi, Princess. Welcome to my life. Like the video as you come in. 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 Like, 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 like the video as you come in. Like and share as you come in. We're going to talk about some mental health stuff today. What time is it? Almost 2 p.m. So we're streaming live on Facebook and on YouTube. Mm. Logan, my strongest man, but they pui. So we're streaming live on YouTube and on Facebook at the same time. So if you miss the live, you can always go back and watch it. You can watch it on YouTube. You can watch it on Facebook. Like the video as you come in. Like as you come in. What thirsty soy? My God. Ha! I don't know if it's a chopper what thirsty soy. How's everybody doing today? How's your Saturday going? Walter, welcome. It's the weekend. How's everybody doing today? What are your plans for the weekend? What is you guys chopping live today? Welcome, welcome, welcome to my life. Today we're going to be talking about some mental health issues that is affecting us. I'm going to start with depression. Depression is the number one mental health disorder affecting people all over the world. That's what statistics say. Statistics. Yep. Statistics says depression is the number one mental health illness that is affecting people all over the world. Hi, Cindy. Hello. We're streaming on both sides today, YouTube and Facebook. So you can watch it on either side. If you prefer to do it on YouTube, that's fine. If you want to do it on Facebook, that is also fine. Happy weekend to you too, mommy. How you guys doing? So we'll see how many people. All right, mama, you watch it later. Yes, yes, yes. First of all, I just came in here. I have to see how many people here because I can't be talking to myself. We'll see how many people will come in, then we start. If not, we'll do it some other day. See, I like to listen to music. That's when my music comes in. Time like this, I'll listen to music while we wait. Mhm. I be just that dance. Oh, dance when I was dance. Bang, it time me. I know it dance. Oh, then never could. I don't want to bottom. The bottom, 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 bottom. I don't need no shower. Who's here? Who's here? Who's here? Hi Solange, welcome to my live. If you're coming in, like the video as you come in. Greetings Solange, how are you doing today? Like the video as you come in. Like and share so that more people can know that we're live and they can log in too. So like and share, like and share, like and share. Like and share, like and share, like and share. Sue, how are you doing, Sue? Susan Moore, hi Mama. How are you? So today, ha, Delta. Today that we're not talking about fashion, you don't enter. Not be smart to know. Today I really wanted us to talk about mental health issues. So I'm live on YouTube as I'm live on Facebook. So I wanted to talk to is Delta. You don't appear today, go bad though. Today that we're not talking bad fashion, you're here. Today we're talking about depression, mental illness. Like the video as you come in, share the video, share, like and share and comment. As you come in, let's dive into some mental health issues. We're going to start with depression. Depression. Depression is the most common mental health illness, the most common. And it affects like 80% of population for all country for the world. Yeah, depression affects everybody. Like 3 in 5 people are suffering from depression. They have it. Yeah, 3 in 5 people suffer from depression. So don't look at your friends. You see this smile. Depression can also be like this. You see this my face. You see all this is just a coverage. It just covers what is inside. Yeah. So don't look at somebody and say, "Oh, that guy said the way they end up ever be depressed." Ah, instead the most happy people are the most depressed. The most happy people are the most depressed people. They just use that happiness to cover up what is really going on inside with them. So you can never look at somebody and just say, "Oh, that man of ever be depressed." Oh no, depression is not about poverty. It's not about brokenness. Rich people, people have money. They have cars. They have airplanes. They own private jets. They have $1 million houses. They have everything that they want, right? They have everything that they want and everything that they need, but they're still depressed. Yeah. Then you ask yourself, why is this person depression? And if you ask them, they can't explain it. It is something that you can explain. You look around you, you feel fulfilled, but there's something else that is going on with you. Yeah, you look around you, you have everything that you need. You have the friends, you have the loved ones, you're married, you have kids, but you're still depressed. So as you come in like this video, share so it can reach a lot of people. We need to reach a lot of people. We need to educate people. Yeah, we need to decrease that if we can reduce the stigma that people have around mental health, we're doing ourselves some justice. Yeah, mental health is very, very stigmatized, especially in our community. Imagine say, even in the Western world, right? Like even in America, mental health is stigmatized. They just imagine back home in Africa, in Cameroon, it is very, very stigmatized. That's why some people just live with issues. They can't even talk about. They die with it because they're afraid to even speak. How are people going to look at me? How are people going to react? How are they going to behave? You know, people talk about everything else. People tell you they have diabetes, they have blood pressure, or I have knee pains, I have arthritis, and it's okay. We'll be like, "Ashia, mommy, well, soon, when." But why is it that when people mention mental health, it's like you guys are afraid, like it's scary? Why? Mental health is like any other thing. Yeah, it's like you having a blood pressure issue. It's like you having diabetes. It's like you having whatever stomach cramps, anything, migraines, anything. It's the same. We need to kind of get away from that stigma and try to educate people to be accepting, to be supportive of people going through mental health issues. We need to be supportive. We need to create a safe space for them. We need to be their support system. Yeah, we need to be welcoming. We need to be able to accommodate them. We need to be able to listen to them. We need to be empathize with them. We need to show them love. Like Susie tagged me on this video is this one of these Nigerian actress. I think she has bipolar. Yeah, so she was talking about the stuff that she's been through. We have people in the community, we have people that have bipolar. We have people that have psychosis. They see things and hear things that we don't hear or see. It comes with the disease process. It comes with the illness. That don't mean we should just alienate them. No. How can they recover if they don't have um, the people that love them, their support? So as you come in, like this video, like as you come in, so we can talk to people. We really need if it can start with me, we need to reduce the stigma surrounding mental health illness, whether it's depression, whether it's anxiety, whether it's bipolar, whether it's schizophrenia, whether it's PTSD, whatever mental health issues. So I don't like, oh, you're here. So we're doing everywhere. Oh, Ma, thank you so much for 50 stars. So eating disorder. You guys see all this bulimia and anorexia. They're all mental health issues. Attention deficit. They're all mental health issues. We need to be there for people. Yeah. You see, even it the body shame people, right? It can set people up, set people into depression. Just the body shaming. When I say, how the man look so, how the man look so, how the man fat so. Oh my God. it can send you to depression. Yeah, so we just need to be careful now. Now things are evolving. People are learning. You understand? Knowledge. People to get more knowledge. So as we grow, we get knowledge, right? We have to be able to normalize certain things. We have to be able to talk about things that bother us and don't be afraid. There was this post I saw on Facebook that supposed to say, "Oh, if you ever ask for help, because then you take it and tell somebody else." I'm like, who gives a shit? You cannot be afraid for stuff like that. People are going to talk about you regardless. So if you need help today, you say, "Hey, I need help. I help you." If even I tell some person, what happen? If I tell some person, what happen? Didn't I help you? Take your help. That's all you need. The issue is if you needed help, you come to me, I don't help you. Then I talk about it. Then you can get angry. Say, Master, I don't go for that guy to me, help me, maybe help me, they work I talk, see the work I tell people. Then that's an issue. But if me, I help you, ah, who cares? You have your help, right? Take your help and run with it. Don't be worried about what will people say, or if A tells B that I came and asked them for help, or if A tells B that I came and said this about my mental health or my struggle. So long as they direct you to the right people, so long as they direct you to where you can get help. Whether you go talk to somebody or you don't talk to somebody, they're still going to talk about you. That's just a fact in life. People will talk about you regardless. So if you need help, get the help. Screw what will people say about you. Yeah, or if the man go tell A or if the man tell B, yeah, it shouldn't matter what they tell or who they tell. If you're going through some mental health stuff, talk to somebody. Don't be afraid. Say, oh, if I tell the person, my business will be out there. If you tell them and they help you, what is wrong with that? Even if your business is out there, so you want to take fear, die. You want to take fear, kill yourself. You want to die because you don't want to speak. Hi, Alice. Hi, welcome to my life. You want to die because you don't want to talk. No, 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 no. You have to be able to speak. You have to be able to talk about stuff. You understand? That's the only way you can get help. Speak up. Once you leave it inside of you, it eats you up. And I going to kill you. And I going to kill you. I know the whole community today, you probably like, oh, if I tell A, they'll tell B, they'll tell C, and so what? You're getting help, right? That should be the most important thing. Are you getting help or not? You're getting help, right? That's what you need. Help. And you're getting the help. So screw what people say. Wait to go change. What will change? So long as you're getting help. So this, my love. My love, where are you? You're not on YouTube anymore. Welcome, welcome everybody that is just joining us. If you're joining us, we're talking about some mental health stuff and we're talking about how to reduce the stigma surrounding mental health. Stigma. When I know what a stigma means, Google it. We're talking about how to reduce stigma surrounding mental health and mental illnesses and different stuff. The good thing with mental health, I say, it doesn't discriminate. Yeah, it affects everybody. The rich people, the poor people, the young, the old, kids. I used to work inpatient psych in the pediatrics unit. In the kids unit, a lot of kids they struggle. Integrity. Who integrity don't help, Alice? Who integrity don't help? It feed you. Does it put food on your table? Master, if somebody can help you and man, screw that, man. It doesn't put food on your table. Yeah. I mean, it's good to have it, but hey, what does it do for you? Yeah. So I for one don't drop that integrity. Drop it, mommy. Drop it. If you need something, speak up. Talk. Get it. Get it. Eat. Whenever you talk about mental illness, mental health, what is mental illness? What is mental illness? Let's dive into it. Hi, Albertine. How are you? There's mental illness and there's mental health. There is a difference between mental illness and mental health. We all have mental health, just like we have our physical health, right? Every human being has mental health, but not everybody has mental illness. That's the difference. Unmanaged mental health, your brain, the way your mind works, your mental health, everybody has it. But then mental illness, not everybody has mental illness. Yeah. Mental illness, it's like mental illness refers to like a range of conditions affecting our emotional well-being. Range mental illness. There's nothing like I have mental illness. Which kind? You understand? So mental illness is a range of conditions that affect our emotional well-being. A range. It means it's plenty. There's plenty of different mental illnesses. Plenty. So you cannot just say, "Oh, I have mental illness." Which of them? There's nothing like. There's no particular mental illness. There's a range of conditions that affect our emotional, So you can mental illness ranges from you can have anxiety, it's a mental illness, you can have depression, you can have bipolar, you can have schizophrenia, you can have eating disorder, you can have postpartum depression, which is still part of depression, you can have PTSD, post traumatic stress disorder, you can have borderline personality disorder, you can have social anxiety, you can have dissociative identity disorder. You can have personality disorder. It's a range of conditions that affect us, that affect our emotional well-being, right? Those are everything that sums up to mental illness. A range is plenty. Pikwa, welcome to my life. And it affects everybody. It doesn't discriminate. There's no gender discrimination. It affects males, females, old, young, older adults, gays, lesbians, straights, everybody, kids, everybody. Yeah, so it's a range of conditions. It affects everybody. It doesn't affect no one person. But today, I wanted us to talk about depression because depression is the number one, the most common mental illness that affects people all over the world. No, I'm on YouTube too, babe. I did YouTube. I did do both. I did stream on YouTube right now and Facebook. So I did both. I think I sent some link. No, you enter, right? You surely enter where I don't start that stop. I had some I be get some small things. So I come out that come back. So I just might do both. So I did both. Right now I thought I just sent the link. Yes. I be don't stop then I got distracted. I began to handle something then I know if you leave I know want to leave on now. So I come on me, I just delete. Then I come back again. Yeah, so I feel stream now for both of them because I live on Facebook on my phone, then I live on YouTube on the computer. Yeah, so now I did both. So I come back now and say let me do both. Yeah. Oh, Susie, all of them will come to the seizures and stuff. Yeah. So today I just wanted us to start on depression because depression is the most common mental illness is depression all over the world. Even small picking the way they born, the way they be depressed, rich people are the most depressed. Happy people are the most depressed. You see me as I smile, so you don't know what I'm dealing with. So not say, no, you don't know what I'm dealing with. So we're gonna start with depression, then we'll gradually go down. No, I'm not doing motivation speaking. No, Tessa, I'm not doing motivation speaking at all. I'm not motivating anybody. I'm not a motivator. I'm educating people about your mental health. That's what it is. I'm educating people about your mental health. No, 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 no. No motivation. So I'm here to share my knowledge that I know as a mental health specialist, professional. So I said, let me bring some of this knowledge so we can spread the knowledge. Like you said, share the knowledge. That's why I'm here. So, like I said, we don't, because when people they talk about important things, I would jam you broke your teeth. So my depression right now is which part today tonight. Some people use social gathering to help with your depression, whatever can help you cope. Exactly, tied to my area of expertise. Yes, exactly. That's what I'm trying to do. So as you come in, like the video as you come in. So today I really wanted to talk on depression. Then we go. We have mental illness too much. We have a lot of different mental health illnesses that we're gonna talk as we go. So it's gonna be mostly during the weekend. I'll try to be streaming on Facebook because some of when I will not go to YouTube. So we'll stream on Facebook and on YouTube. That way the YouTube people that can watch it and the Facebook people can watch it. So before we dive into depression, what is depression? We talk about this thing every day. Only man is say I'm depressed, I'm depressed. You say things you don't even know what it is. What is depression? Every day, somebody just be stressed so small. I'm having depressed here. I'm so depressed. Do you even know what is depression? Have you ever even looked it up? Have you looked up the depression, the signs and symptoms, the definition? What is the word you're using? Does it even apply to you? You understand? You know me say maybe something not go the way you want them, you be depressed. No. You know me say maybe you be put your money for years, someone take now you be depressed. No. You understand? No. What is depression? Ma adjust my camera small so. Why they let sudden on one side eh? Why look one sided so yeah. So if I tip you $10, no call Eddie say, hey, if you have me depressed here, it don't take my $10. Why? My camera for YouTube don't fall. Now wait so I beg. Oh, let me adjust it. Oh, I think it's better now. I think so. No, that don't mean you depressed. Oh, thanks, Steph. Depression, right? Like I said, is a mental illness, which not everybody has mental illness, but everybody has mental health. Depression is a mental condition, right? That is characterized by a persistent depressed mood, long term, like you lost pleasure in the things you used to like to do. There's sadness, there's loneliness, there's withdrawal, low motivation, your energy level is poor. You know, it is some people when they're depressed, they sleep too much. Some people when they're depressed, they can't sleep. Some people when they're depressed, they eat too much. Some people when they're depressed, they can't eat. So depression, you see this overeating, people bury themselves in food when they're depressed. Some people can't even eat when they're depressed. So it can be either way. So people feed their depression with food. You understand? They try to cope with their depression with food. They eat. Some people can't eat. Some people just sleep. They don't want to be bothered. They don't want light. They will not even open their blinds. Some people don't even want to get up and take showers. They have no motivation to do anything. They don't have interest in anything. All they want to do is just be by themselves. They want to be left alone. They will stay in bed all day. They will not even get up to eat. Some people, they're very sad. They're very irritable. Like the least thing sets them off. You feel you open their door, they vex, they holler, they shout. You turn on lights, they get angry. Some people are opposite. They overeat. Instead, when they're depressed, they eat a lot. But then they lost pleasure in the things that they like to do. They don't have no motivation. They just see somebody say, well, how do man on this? I need to see again. In no one doing no nothing. Each one be. They just want to be left alone. They stop for social life. Social gathering is not a thing for them anymore. They go outside, they panic, they're afraid. Like the video as you come in, like as you come in. Some people can't sleep. They have disturbed sleep. Yeah, they have this. We call it disturbed sleep in mental health. Like you can't sleep. They can only sleep for like 1 or 2 hours, and that's it. You understand? You lie down for bed, your mind is just the go. You're the one that you can't sleep. You have too much in your brain. Your brain of it shut down, you know if it calm down, you know if it sleep. Disruptive sleep. But some people sleep instead when they're depressed because they don't want to think about what they're going through. They don't want to sleep them off. They just want to sleep. Like the video as you come in. Like the video as you come in. Oh, Tessie, thanks for 100 stars. And the worst part of depression is the suicidal ideation, suicidal thoughts. Yeah, we call it suicidality, whatever it is. But you wanna get my point. Suicidal thoughts. You start feeling like you want to die. You start feeling like you want to hurt yourself. Like you don't really reach for some place. You're in a very dark place. You just want to give up. That's the worst part of depression. When you get to that stage, if we're not careful, we're gonna lose you. That is when you get to that stage. If intervention, never ever be intervention has to come in. One of the most reason people commit suicide is because they're depressed. They lost hope. They feel hopeless. They feel worthless. They feel helpless. They feel like they don't have help. They feel like there's nobody out there. Like, they don't have no worth. When you start questioning yourself, what am I doing here? Why am I here? What is there for me? What is in here for me? Then you don't go down deep in depression. We don't even know. You're not even thinking of means to help you get out of that place where you did. That is when that suicidal thoughts start coming in your brain. Suicidal thoughts. It is start coming. Some medications too can make you suicidal. Yeah. Bipolar people too, they're very suicidal. People that are bipolar, they're very suicidal. They kill themselves a lot. They commit suicide a lot. Yeah. People that use substance too, they're very suicidal. Because when you take stuff you don't think right, yeah, it's easy to kill yourself. Then you see depression too is the most common. The common reason why people commit suicide is depression. The most common reason, right? Why people even that's why I wanted us to start with depression. The most common reason why people even start taking substances, illegal substances, people start doing drugs, they become alcoholics. You know why? They're depressed. So now they self-medicating. They're using because some people don't like antidepressants. They don't even want to talk to a therapist. They don't want counseling. So they start to self-meditate, medicate. You understand? So they start using things to help them forget about your issues or whatever they're going through. I met this lady yesterday. Not even that I met her. She was one of my clients yesterday. My telling about the woman. This lady came to me yesterday. She was crying. She was sobbing. She was tearful. Ah, no man cry so that's sorry. Then they say my joy join it to more cry. I only say, Mayum, don't cry. Everything's gonna be okay. I don't know what you're going through right now, but don't cry. So I tell my medical assistant, I said, give her like a tissue. So we started talking. I said, ma'am, what is going on? Like she came in for a psych evaluation, right? So I said, what brought you in? So she started telling me she's lost everything to drugs until now she's living with her mom and her brother, and they're not treating her right. Let me tell you guys why she started doing drugs. This woman had a six-figure job. She was making good money, as in good money. She had everything going for her. She was rich. She said she lost her husband, right? She lost her husband. When her husband passed away, she was very, very depressed. She went to a very dark place. She said she could not come out from that dark place. She said, Mister, I was so depressed. I didn't get out of my house sometimes for like 5 days. She said she didn't even shower for days. She didn't eat for days. She didn't talk to anybody for days. That's how bad her depression was. She said she thought about suicide so many times. She was like, Mister, I just wanted to die. I was so depressed, I just wanted to die. I was thinking about suicide every day, every day. She said one day a friend came over to her house. When I say how people they enable people, she said one day a friend came over to her house and said, you need to come out. You need man, your husband is there. We buried him. You need to come out from this place. You need to shower. You stink. You haven't eaten. You look malnourished. Blah 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 blah. She said, okay. She got up, took a shower. They went to another friend's house. Guess what? They gave her meth. She said, Miss Pa, because I think when she came to me, she, what, how old? She's 62, either 62 or 65. She was married for 30 years. She said, Miss Ba, I had never ever done drugs in my life. She said even marijuana, she never tasted marijuana in her entire life. Never tasted marijuana before. Never. She said she did meth. Guess what? She felt the high. She liked it. Methamphetamine. I don't know whether I'll get meth for Cameroon. The meth is a substance here that kills people like crazy. Because when she came to me, she was abusing meth, fentanyl, and cocaine. She said, Miss Pa, I had never done drugs in my life. They gave me meth. It was so relaxing. It felt good. And that is how she got hooked. She said she started self medicating with meth to help with her depression. So now you wait at the top, right? It comes back. Depression is the number one reason people abuse substances. You see, all these drug addicts, all these alcoholics, they drinking to numb the pain, to numb whatever they're going through. Yeah. When I see the face so, there's something behind it that you guys don't see. There's something that eats people up that you guys don't see. So people use other means to numb their pain, to cover up what they're going through. So when that lady we talked, she said, Miss, I've been sober now. She actually had to relocate. She had to change states. She moved to another state to start from scratch because she didn't want to be influenced. She did rehab a couple of times, but she relapsed. Every time she went in patient rehab, she comes back, she hang around the same people that are doing drugs. It's like a speckle. She relapses, she start using drugs, she goes back. So she just said, let her move. And luckily, she saved her life because she's been sober now for like 6 weeks. Yeah, from fentanyl, cocaine, methamphetamine. She's sober now. Where did her drug abuse history started? It started from being depressed. Depression took her to where she started doing drugs. She started self-medicating. I asked her, I said, did you ever talk to a counselor? Did you ever do grief therapy? I said, you ever do grief therapy? She said, no. I said, why not? You lost your husband. That is traumatizing. You've been married for 30 years. You lost your partner that you've been with for this long. You should have seek counseling, seek help, talk to somebody. The instant no, it just she just buried herself in a depression. Then started using drugs. Yeah, then she started using drugs. Yes, more depression is real. You have to be nice to people because you don't know what they're going through. Some people are very fragile. They have very fragile hearts. Some people have very fragile emotions. Some people have very fragile emotions. Like the least thing would just take them back. They're not strong. Some people don't have strong hearts. Their mind is very fragile, it's very soft. You can just tell it, say, boy, why they are shoot they so oh my god, you've killed them. You understand? That's why we really need to be careful how we talk to people. Because you don't know what people go through. You don't know. You don't know how people process information. You don't know how people process criticism. Some person do it even compliments it panic. Some people even compliment, they take it differently. They feel like say, oh, you're not complimenting from your heart. They start fear. Depression, anxiety sets in. Yeah, some people are very fragile. Their mindset is very weak. Some people are very weak-minded. They're soft. So if we have people like that around us, we need to know how to deal with them. We need to know how to talk to them. We need to know how to manage them. Not everybody is the same. No two people are the same. The way you can tell me something and I handle it, it's not the same way you can tell B and take it. Yeah. You didn't see my glasses, so you black and say, ah, you better glasses well, why this or just laugh. I said, Master Betty, help me see, you understand? Hey, but you can tell somebody else, say, Boy, how their glasses were also. Mamma mia, you know, you've killed them. Yeah, you've killed them because not everybody knows how to handle stuff. So we have to be very careful. Yeah, yeah, we have to be very careful. Yeah, people, you need to work on yourself every day. You need to know your weaknesses and your strengths. Your strengths are there. You don't need to do anything. What you need to do is work on those weaknesses so you can strengthen them. Yeah, exactly, Grancy. Some people are right there at the edge. That's what they did. This is how they are. So the least thing you do is just it pushes them down the cliff because they were already falling, but they be hold on, right? Then the least thing you do is just makes it damn say it just push them inside. That's it. We body shame people. You don't even know. So as I said, some people say I'd rather work on my strength than focus on my weaknesses. But you want to work on your weaknesses too, because your strength is already there. You know your strength, right? You don't need nothing else with your strength. But if your weaknesses is where you're falling behind, then you have to work on them to so you feel strengthened. Those weaknesses can become your strength tomorrow. You understand? If you work on them, yeah. So we have to be very careful how we deal with people. We have to be very careful how we talk to people. Don't not blast someone say you the joke with it. No. Maybe that blast will blast that person so the person be there for you as you blast you judge drop. Yeah. Instead encourage people. Be your support system. Create a safe space for them. Exactly. More see I know. See you see what I mean that you connect. Oh, I have dealt see anything that I cannot manage, I cannot take care of. I don't dare I need deal with them for too long. Eh, Yeah, exactly. We must try to transform those weaknesses into strength. You can't just deal. You can just rather focus on your strength. Why are you focusing on your strength? Your strength is already there, but your weakness is what you need to work on. Yeah, focusing on your weakness is an exercise in futility. Exactly. Evaluate yourself. Look at yourself and be like, what part of me do I need to work on? You see now, what part of me do I need to work on? Look at your life. You feel say, first of all, I'm a hardworking woman. I'm intelligent. Those are your strengths. I know how to communicate. All that you already know that. Then look at your weaknesses and say, hey, I don't know how to deal with people. I'm not friendly. Work on those. Work on those. You feel work on your social skills and it becomes your strength. Evaluate yourself, evaluate your life. Look at the part in your life that you feel like is not living up to standard. Look at the part in your life that you're not living up to standard. You try to work on them. Your weaknesses are your weaknesses, and your strengths are your strength. Use your strength. You can also use your weaknesses to make them become stronger. It's just gonna move on to your strength, and it's just gonna make you stronger. Yeah. Sometimes you go for a job interview and they ask you, what are your weaknesses? You're not interviewed. They'll ask you as strange. You don't tell them I'm flexible, I'm dependable, I know how to communicate, I'm this and that and that. Then they come now, they say, oh, what are your weaknesses? Then you start thinking, what are my weaknesses? You need to know what your weaknesses are. Because your strength, you already know what your strengths are. You need to know what your weaknesses are. Because that's one thing they always ask when you go for an interview. What are your weaknesses and what are your strengths? Because the best way to interview you, they want to know where you lacking behind. That way, when they bring you to the team, they can know how to help you. You understand? They can know where to come in and help you out. Like the video as you come in. Like the video. Like the video as you come in. Yeah. You also have to think about your happiness should be your number one priority. And also don't we don't go so depression. Mm-mm. Depression. We need to. If you have friends that are going through depression, find a way to reach out to them. Be their support system. Be their safe space. Talk to them. Try to help them. We make the mistake of focusing on our weaknesses and ignoring our strengths. Some people actually do. But your strength is, I mean, you already know your strength, like I said. So, Lord have mercy. Let's see what's going on here. Just babes on my YouTube. Thank you so much for the engagement. Keep him coming, man. Keep him coming. So if you're coming in, like the video, like the video. So some of the signs you can look for when it comes to depression: persistent sadness. You know how you see people they're always sad. Like you can never cheer them up. Whatever you do, they're sad. You understand? Whatever they do, they're sad. Loneliness, they just want to be alone. They withdrawn. They stay away from people. They don't want to talk to anybody. They don't want to be bothered. Those are some of the signs that we can look for. They have no motivation. They don't want to do anything. You can see somebody that was exhaling in life. They were doing very well. They've accomplished a lot for themselves. All of a sudden, they just change. They don't want to do anything. Even your business, they don't want to run that business anymore. Your family, they start staying away from people. They start staying away from family members. You don't see them in social gathering anymore. We need to reach out in a nice way. Not to say, I said, the man, where did it go with you? Why you make so? You be depressed? No, don't say that. We cannot approach people like that. No, there's a better way to approach people. When you're supportive, people will talk to you. When they feel like you're somebody they can talk to, they will open up to you without you even asking them. Yeah, you can say, "Hey, what's going on? I haven't seen you in a while. I don't see you anywhere. You know, I'm here for you. Whenever you feel like you want to talk, just know I'm here for you." Leave it at that. Don't no push them, no push them plenty. Yeah, just leave it at that. So just know I'm here for you. I got you, bro. I got you, sis. I don't know what you're dealing with right now, but whenever you feel like you want to talk to somebody, I'm here for you. Yes. No judgment, nothing. Just be that person. Don't push it. Yeah. Don't even ask them what they're going through. Just tell them, hey, bro, I'm here for you. Whatever you feel, whenever you feel like you want to talk, tell them whenever you feel like you want to talk, I'm here for you. Just know I got you, bro. Leave them alone. Don't push it. When you start pushing it, people feel like you want to be all up in your business. They're not going to talk to you. Yeah. When they feel like, why are you asking all these questions? Why you want to know where to go on with me? They're not going to talk to you. Just tell them I'm here for you. I don't know what you're going through, but whenever you feel like you want to talk to somebody, I'm here for you. Leave it at that. Don't meet him and say, hey, bro. Now, what did it happen for you? The man never see you. Why you look so? You just look depressed. What is going with you? How you want my talk for you if you approach me that way? Think about it. How do you want me to open up to you if you approach me that way? Yeah. Asking too many questions is weird. It will throw them off. They don't want to come to you. Just tell them, hey, bro, I noticed that the things that we usually do, you don't want to do them anymore. I've noticed that I don't see you in places anymore. We call your phone, you don't answer. Nobody's, I mean, we talk to some people, they say they haven't seen you, they haven't heard from you. Well, I don't know what's going on with you, but I'm here. Whenever you need a listening ear, I am here. Leave it at that. Let it be their turn to come talk to you. Leave it alone. You've done your part. You don't put yourself right, so you're there for them. Leave it alone. When you start pushing, then they don't want to talk to you because they start thinking like, why are you so interested in knowing what is going on with me? Yeah, then they don't want to talk to you. You push them more deep into what they're going through instead for you to be the welcoming person and just leave them alone. You've already created a safe space by telling them I'm here for you. That's good. That's all they need. Don't push it. Yeah. Some people need time to process what is going on with them. They will talk to you when they feel like it's time for them to talk to you. There's also time where we can intervene. But if it's just if it's just something that you've noticed, like it's okay, leave them. They'll come around. But then if it goes on for months, then we can intervene because you don't want somebody to die in silence because they don't want to talk to anybody. The depression just keep eating them up, eating them up. Then they can't reach now for that point where they be suicidal. They just want to die because they feel like they're alone. They feel hopeless. They feel worthless. They feel helpless. They feel like they don't have anybody. They cry all the time. Some people cry all the time, but they don't know why they're crying. I have patients that have everything. They're depressed. They don't even know why they're depressed. They have everything. Nothing is lacking in your life, but they have major depressive disorder. They go through severe depression. They don't know why. Some of them, when we dig deep, right, they will discover, say, they have some unresolved trauma that they never resolved. It don't come now when they are adult, right? It eat them up. Because I have people that come to me, Miss Pa, I've been crying for 2 days now. I don't know why I'm crying. Like your emotions is all over the place. Exactly, exactly, Tess. Yeah, exactly. I understand. It is hard. It is hard when you have like your brothers and sisters that they're going through some stuff. They're very depressed, but they don't want to open up. They don't want to talk to anybody. How can you help them? How can you have somebody in that state? How can you be that support that we're talking about to somebody that you know is really, really needing help, but they don't want to open up? How can we come in and help them? We can't just be on the sideline and just watch them, you know, just drown in their depression. We can't. That's when it gets to the point where we know your wait me the can't tell we say, hey, I'm ready to talk to you now. Bros. Someone will die for your frontal. Hey. Mm. person will die for your front because the wait say make time for can't talk reach. People committed suicide a lot. The number one reason people commit suicide is because they're depressed. Depression has a whole lot of symptoms. Yeah, it makes people become very suicidal. Imagine you start feel worthless, you start feel hopeless. Do you know the next thing that will come to your mind? Majo better die. The life saved no before me. Wait today for the life. That'll be the next thing you think about. Yeah, that'll be the next thing you think about. Yeah. If you live at home with somebody, they don't eat, they sleep all day, they don't even want to shower, they don't want to get out of bed, they're lonely, they're withdrawn, they don't want to talk about to anybody. We need to watch them. Like a person if easily kill itself. Like a person if easily hurt itself. Yeah, depression is very real. Our community people suffer. Depression eats them up gradually. Yeah. It bites you. So it's like a small insect will go bite you, right? Then the wound start going deep. You want to notice that the wound it eats you up deeper, deeper, deeper. Then you can find yourself for some very dark place where you don't know how to come out. Yeah. When you reach for that dark place where you don't know how to come out, guess what? Suicide is the only thing on your mind. That's it. Because you're like, what is there for me? Suicide is the only thing you want to do. You just want to kill yourself. Rich people are very depressed, just like poor people. Mental illness does not discriminate. That's why we're here. We're here. We are the help. We're here to help you. If you find yourself in that dark place, you don't know how to get out. We are here for you. We are your help. We are the professionals that you need to talk to. Exactly, just babes. Rich people are the most depressed. Happy people are the most depressed. They just hide. It's like a mask they wear just to cover that depression. Make no man will see them. Because nobody wants to see, like, people hate when you figure them out. You understand? People don't like it when they're going through some stuff that they don't want you to know and you figure them out. So they find other means to hide it. That way you cannot see through, you cannot see through to them. Boy bongo, you're correct. You're right. Some people in our community does not open up because we always have a tendency to use people demise as entertainment topic. But my point is, do you want to die because you're scared of what people are going to say, or do you want to speak and get help? Think about it. Think do you want to die? I remember even on Tori Day show, we had the same thing you just said, boy bongo. Somebody brought it up, and I said the same thing. What is it? Do you want to get help and survive and be there for your family, your kids, your brothers, your sisters, and the people that actually love you? Or do you want to just be quiet and don't speak, then die? Then you leave all these people that love you to mourn for you for what? Because you're scared what people will say? People will talk. You understand? People will always talk regardless. People will always talk regardless. What is more important to you? At this point, you have a choice. Your choice is, do I want to live or do I want to die? What is more important to you? To live, to speak and live and get help, or to shut up and die in silence? You know these things people say, demand die in silence. Is that what you want to do? Because at this point you have a choice. Do you choose to live or do you choose to die? So it's up to you when it gets to that point where you really need help, but you're like, oh, what will people say? Then get to a professional that is not from your people. Talk to a professional that is not your people. Yeah. Talk to somebody. If you get That's why we say there's help. If you don't feel comfortable with your own people, talk to somebody that is not your people. That you know your privacy, confidentiality is going to be maintained. Talk to them. Yeah, talk to them. The professionals. If you don't want to talk to your, don't if you, what you expect? Tell me. You go through some stuff. You talk to your friend one at the drink together. What you think they go do? How you going to help you, sef? If you know it's serious stuff, get professional help. If you think it's serious like that, get professional help. Don't talk to your body, they will quarter. They will talk about you and they know help you, safe. Yeah, when it gets to that phase, yeah, talk to somebody. Something that will worry you so. When you know, see, if he kill you, you keep up for yourself. No, 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 no. You got to speak to somebody. You see this issue that we go with, we talk about mental health issue. Is there like anything? Is there like might get diabetes? It's like anything. Yes, talk to a professional. You might just need counseling. Some people actually need medication. We give them antidepressants. Some people need meds towards the counseling. Yeah, it will save some people. It's not going to save everybody because antidepressant works differently for any person. Yeah, they work differently for other people. You have to talk to somebody. Talk to a professional. Come out for your community. Come out for your circle. Go talk to some person. We maybe know you. One, that person get license to protect. They're bound by HIPAA. They cannot take your information and tell anybody else. Get the help that you need. Yeah. Don't never feel like there's no help because all my people will talk. Yeah. Your people are always gonna talk. Exactly, Ruth. When I hear to Ruth talk, Ruth say, if I want to put you in a tight place and it come as a client, of course, the point one I need understand I say we we have licenses to protect. I have license in Texas, Colorado, New Mexico, Arizona, how you call it, Washington, and Oregon. You understand? So I can take care of people in those states, right? You're bound by the board of nursing, the ethics, and whatever committee and HIPAA. If you come to me and not even talk your matter for outside, because guess what? If I talk your matter for outside, you hear. Well, you know, say it was confidential. You know what I'm gonna lose my license. And if I lose my license for Texas, I'm gonna lose my license in all that states. You feel say I want to do that kind of thing for myself. That's my livelihood. That is what feeds me and my family. That's where my money comes from. You think I want to play with that? So talk to professionals, talk to people that you know they have so much to lose. Talk to people that you know they have so much to lose. I have so much to lose. So much. You know, you're all the places where I've been licensed. If I mess up my Texas license, guess what? It affects all my other licenses for all the states that I've been licensing. Wait till what am I going to do now? What? I don't know me, I see. Where do I start? Something that you worked for so many years, you want to take God to spoil them. I want to die. I can't do that. But if you go talk for man for street, where you don't get nothing to lose, nothing to protect, guess what? They're going to talk about you. That's why we say seek help, talk to professionals. Yeah. That's why I say talk to professionals. Talk to people that have licenses to protect. Even if it is in your community, they're not going to tell anybody because you will make money from them. Breach of confidentiality. Do you know how much malpractice insurance would buy? Ask any man. Do you know how many malpractice insurance we pay for? A lot of money because they will sue you. You breach confidentiality or privacy, they will sue you. If you don't have malpractice insurance, you cannot even be a professional without malpractice insurance. You because who say you get the money for PPE? If someone comes to say, "Oh, I went to my provider and we talked about these," and then she tells you breached confidentiality. I heard about it in my other friends group. Bo, the lawyers will take your case where you not pay the 5 rand because they know they're gonna make money from it. We pay a lot of money for my practice insurance so in year 1 year, and you renew it every year for stuff like this. Yeah, it's another like do me, and then like not be say, oh, Tripolicious, thank you so much, Tripolicious, thank you. Not that I just feel like not that I don't want to help my people. Like rooftop, they put you in a spot, but strangers you don't know them. Besides, since I've been a nurse for a long time now, before I even became a practitioner, I've learned not to talk about patient stuff to other people, like high consenting. You understand? High consenting. I don't talk about my clients. Even my clients, you guys don't even know them. I don't even talk about them. The one more of somebody that I know, well, not say my license be on the line. Yeah, we have to educate people to talk to professionals that have a license that they have so much to lose. So if you're going through some stuff, find professionals. If you need counseling, if you're in that place where the only thing that is going in your mind at that point is I want to kill myself, I want to die. When you get to a place where you're suicidal, seek help. And why you wait till you get to that point first where you be suicidal? Why didn't you get help when everything started? When you feel like those depressive symptoms are kicking, get help immediately. We've had little kids commit suicide, little kids, 12, 13, 14. They die. They kill themselves. You know who said everything is that? That depression. That's where everything starts from. That's why I said let's start with depression today. Everything always starts with depression. Yeah, depression eats people up, and it's so common. It's the most common mental illness all over the world. Look them, Google them. The statistics to back it. All over the world, 3 in 5 people have suffered from depression, or they've suffered from depression at some point in their life. Yeah, this is my grandson. Okay, I get to click to read. Oh, so I don't go away. As a hyper, I get to come closer. Me too. Blindness no live on my even my glasses. I still get to come closer. As a hyperactive woman in her late 30s, still trying to get more babies, I fell into depression when I had an ischemic stroke. Yes. See, medical illness led her to depression. Imagine. Okay, Mark talk about the grandsons more. Imagine, right? Just imagine like me now. So I'm very hyper. I like social. I like to go places. I like to do things. I like to interact. I like life. There's something happen for me. When I not live that life I be living. What you think say will happen for me? Automatically you'll be depressed. Yeah. Those are life changes that will put you into depression. Yeah. She had a stroke and she was paralyzed on her left side. It put her into depression. She battled with it for 12 years. You see? She said she contemplated suicide a couple of times. But then she remembered that life was worth living. You have to find your purpose in this life. You have to find your purpose. Yeah. She had to find she had to find a purpose. There's more to life. She thought of suicide, she thought of killing herself. But then she remembered that life is worth living. If you have a purpose, right? Once you date in some deep place, just the purpose where you get them and the people that you love, that you care about them so much. You decide things, say, if I don't date tomorrow, how what will happen? See, I mean lie you automatically get out of that place. But if you don't get you no purpose for life, ah God, when you fall into depression, it will just eat you up, scatter you, kill you. When you don't have a purpose. Yeah. When you don't feel like I don't have anybody out there for me. Nobody cares about me, nobody gives a shit about me, you go down. Yeah, it's gonna take you down instead. In this life, so any man gets, we have to have purpose. We have to. Yeah. People go through a lot. See, she said social media has been such a positive route for her. People use social media to as an antidepressant. Yeah, so when you guys see people, why the money about people social, you don't know. Maybe nobody really can. Maybe I support that. Maybe that's one of our coping skills. Maybe that's one of her coping mechanisms. That's how she cope with whatever she's going through. So we shouldn't be too quick to judge people by just what we see. You see me, I love music. Oh, when I get to that state where my mind is clear, where I feel like I'm drowning, music is my go-to. Music is my go-to. I love music. I think that they shout me one day, say we no sing, I must sing. Music is my go-to. When I'm drowning, when I feel myself drowning in my depressed state, I go to my music. I go to my music. It helped me. It helped calm me down. It helped. It's like it's my own coping. It's how I cope. When I enter that grand setup, social media is how she copes. You distract yourself from social media. Missy baby, welcome to my life. You're not late. It wasn't something. We're just talking as we go. Yeah. So you can always come back and watch it. Yeah. Social media is a coping skills for a lot of people. Some people when they go through depression, right? But people can't talk so a foolish thing about social media. At that point, it don't help distract you. When we can't do the laugh, we story, back and forth, back and forth. It distraction is another way to cope. We tell people, find something you like, find a way to distract yourself. That way you're going to take your mind off whatever is going on with you. So people use different means to cope with your depression. People use different means to cope. We shouldn't be quick to judge people. Yeah. Make will not be quick to judge people. Exactly, just babes, you don't know what they're going through. You not see me so. Anytime I take picture post on Facebook, I'm not happy. And it's because I don't go me down to them and depress it. When I see that thing on I can't comment like, yes, it keep me. People have a way of coping. People use different means to cope. We come to social media to relax, to release, you want to relax your brain. Which you they do? Sit down for your bed, feel lonely, and they cry all night when you can just come and interact with people, with strangers that you don't know. When I laugh, when I join Jackery every now and then, someone post, you go comment on that, when I come on and share comment, you dey feel alive. You dey feel like you know these people. You don't take your mind off stuff. Before I know, they don't break. Do you guys know how many times I dey sleep for bed, sleep me enter my eye? It's should have missed the baby tell now. At the text level 2 a.m. It's I say, Mommy, you need to sleep. I say, Belly, I'll sleep outside. How do sleep? Sleep come. Yeah. Disruptive sleep. When I tell about some of the signs of depression, disruptive sleep. You don't sleep. Anxiety to the inside. There's things in your life that is not going right. Anxiety steps in. That's why your mind the play. We call it racing thoughts. Your mind keep going on and off. Enough is settled down. Enough is shut down. You cannot sleep. Depression and anxiety, they're like 5 and 6. Depression and anxiety is like 5 and 6. Most often, when people are depressed, they have anxiety. Most often, they go like this 5 and 6. Yeah. Anxiety too. Oh my God. I've had clients where anxiety they make and they damn say they want to die. Yeah, you know if you sleep, your mind is not at peace. Your mind is not at rest. How can you sleep? Your brain they work over time. Your brain keep racing. Yeah, your brain they race. Sometimes at night I don't sleep. And I like I know if you sleep. I did just take my phone so because I don't want. I feel like the more I sit there, I feel more miserable because I can't sleep. Everybody's sleeping. I'm just lying there, miserable. My brain is working overtime. I just take my phone, missing baby. It ever stuff of my hand. If you don't tell me, so I don't know what I do. I just text her. I said, but because in Europe, I'm not in the morning time for them. The night for me. I just text her. I said, man, how if you need sleep? I said, I know if sleep. When I tell you like so, stress for the life you kill person. And then like that's what we're talking about. You have to find a means that works for you. Depression is real. It will eat you up and kill you. Yeah. Sometimes you just sit and say, people will be better off without me. Or why am I even here? That depression will eat you up. Yeah. Anxiety comes in. Ah, anxiety comes in. Panic attack gets into it. I know people that cannot go to like Walmart because of their anxiety. People no fit go Walmart, like they no fit be for play with people today. They have social anxiety. They can't be around people. There are people that cannot even drive a car because of their anxiety. They can't. Just Pepsi, you see, you're right there with me. I swear, you did search till about 3 a.m. morning that way, maybe no. You start looking for stuff. The most time I spent money in my life now when I know fit sleep. And then like that is when I don't struggle, all other means I not fit. I take my phone, I start do online shopping for 3 a.m. morning time. The most time that I buy the craziest things at 2 a.m. in the morning, 3 a.m. in the morning. I did buy tickets over 1,200. One never even know where to go. It's like then that is the point where my impulse, I have poor impulse control at that time. My mind, I need to think. Yeah, I need to reason. Poor impulse. I just use money anyhow. Then when I wake up, when I don't struggle the next day, I say, what is this? What's kind like this? Yeah. Depression will eat you up. Me, I use my clients, I dey heal, I dey treat my clients, I heal. I dey treat myself in the process. Oh yeah. I talk to them, I dey talk to myself too. It is helping. People go through some serious shit. I know like una. You see no more. See, I don't tell you no. Yeah. When I'm most depressed, I spend the most money. I'm reckless with money when I'm depressed. Very reckless. Very. I buy the wrong things. Half of the time, I'm doing the wrong shit. Yeah. See, I wish I can do that. I say, I wish I can do that. I don't have that kind of willpower. Yeah, because that is when you spend the most money. You're reckless. You just do things. That time then so no me. Oh. Yeah, exactly. I wish I could restrict myself to after 10 p.m. No more online shopping. I'll be a rich girl. Then I lie. When I sleep with that business, sleep me enter my eye. I do some crazy shit, man. That is bad. Yeah. So be somebody, be somebody's support system. Support people. Create safe space for people who come for you, can tell you their problems. And when they tell you their problems, don't be judgmental. Now that judgmental too, na make no money if you talk no nothing. We are so judgmental. We as humans, we as people, we're very judgmental. How do you expect people to talk to you when when they just think say, wait the man will judge me? Wait till the man will think, wait till the man will talk. People need safe space to come in. You see depression, anxiety, they like 5 and 6. I I know the population and size of literally every country in the world because of depression. Sleep not the enter. You did not do things. You did not think things. I swear. You buy things and regret. Because you're just trying to cope at that moment. You're just looking for anything that will interest you. You're just looking for stuff that you can do to distract your mind, to make your brain rest, for calm your brain. You do things that you don't usually do. Yeah. You do things that you don't usually do. Depression is very tough, mommy. Just the depression is very tough. It is difficult. It can affect you in any stage of your life. Any stage, any time, any stage. It's not because you lack anything. No, you don't need to lack to be depressed. Rich people are depressed the most. The people that have everything in this world, but they're the most depressed people. Okay, think about it. Why are young kids depressed? They don't even have a life. They don't have nothing. They're alive, but they're depressed. Why would a 12-year-old child commit suicide? Think about that. Why? Where did the stress that pikin? That pikin they pay bills. You never get man. You no get pikin them. You no get no nothing. You still live under your parents. They do everything for you, but you're depressed. People divorce. They go through depression. Spouses die. They go through depression. Some people take some certain medications. It put them into depression. You lost a child. You be depressed. You get into a car accident. You'll be depressed because maybe your one limb or your knee, you don't function as you used to be. When I answered that girl said, she had a stroke, she was depressed. People they diagnose them, even hypertension, they be depressed. People they get they diagnose with diabetes, they be depressed. So there's nothing to be ashamed of. No. See when that Benny Murdoch, when was that in America? When this stock market they had this man that was investing people's money and people find. Do you know how many people committed suicide? People lost a lot of money. They were so depressed they commit suicide because they felt like they didn't have anything left for them. Yeah, yeah. People have everything. Like you come to their life, everything seems perfect, but guess what? They're very depressed. So it's not something to be ashamed of. We need to start destigmatize mental issues. Yeah. Depression is like high blood pressure. It's like diabetes. We live with these things every day. If there's three people standing, two people have depression. Yes. You see? Yeah, that stock market. There was one time the stock market crashed. Oh my God. That time suicide every time one day the man okay, they said if you invest $10,000, if you invest 10 million, if you invest people were committing suicide left, right, and center because they start blaming themselves like if I had known, I wouldn't have put my money here. If I had known, my money would have been saved. That's it. Self-blame, guilt, it will kill you. Look at the comedians that kill themselves. Look at these comedians. They're very rich. They make me happy, but they're the most depressed. Look at the comedians. They make we happy. They come create comedy, we laugh. But guess what? These are the most depressed people. You're the ones just see, oh, the comedian don't keep go commit suicide. Anthony Baldwin. Ah, that papa he died, he vexed me. He was this man that goes around the world with CNN. He eats every food, eat chop, even rabbit, even snake, even millipede. He would travel all over the world. Oh, Benny Motors. Thanks, just baby. Yeah, I remember that time for Benny Motors. And see, Anthony Baldwin, he goes everywhere. He eats everything. But guess what? He was very depressed. Ah, I remember when that man died, I called my small sister, I said, baby, where's the day again? Because you look at these people, you see they have everything that works for them. They're happy. They look happy to us. They look happy to us. You want them in life. You didn't look at the envy. So this is a life that I want. But guess what? He's dealing with a lot of stuff. He killed himself. Yeah, he killed himself. Robin Will, these rich people at the nah. See, postpartum visited me and never left. Yeah, a lot of people suffer. You know what it just, babes? There's this woman in New York. She suffered from postpartum depression. She killed herself and the baby. Guess who this woman is? She's one of the biggest doctors in New York City. Postpartum depression. She killed her child and she killed herself. She's a well-established doctor. Robin Williams, too, the comedian. She committed suicide. He committed suicide. Depression. This lady in New York, this doctor in New York is like the most recent, renowned or influential or popular person. Postpartum depression. She killed her baby. She killed herself. A lot of people go through postpartum depression without even knowing it. Just best, thank you for even bringing that postpartum depression because it's part of depression. A lot of people go through it without even knowing. Some people have babies, they are beginning to cry, you know, if you want touchy. That's postpartum depression. Yeah, you need look at application, you know what even see. That's postpartum depression. Yeah. And some of those depression, when they come in after birth, they never leave, they never go away. You have to suffer with them for the rest of your life. Excuse. And you see, depression, it is Mr. Mano tells you they cure my depression. No. There's no mental illness that is curable. Take it from me. Ask any professional. Yeah, there's no mental illness that is curable. It is manageable, not curable. We manage the symptom. We don't cure the illness. You understand? We manage the symptoms that come with the illness. We don't cure the illness. It is manageable. It can be dormant, but something will trigger them, it will come back because it has never gone away. We treat the symptoms, you're okay. But then something will trigger you, right? That everything will come back. And Tony Body, ah, Crystal Mamisi, I wanted his life. The day when that man died for apartment from New York, I was shocked too. I never ever fear so. I shocked. I caught because we follow it every day. He was one of the reasons I was watching CNN. Yeah, he died. He had himself in his apartment in New York. Depression. He went all over the world. Eat. That means even the meet all kind of people that say the CNN was paying him buku money. When I say what I talk, money doesn't stop. Money, no, 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 no. Money doesn't stop you from being depressed. It doesn't. See Twitch. Exactly, Martina, see Twitch. When I remember Twitch, that Ellen DeGeneres DJ, I forgot about that boy. See Twitch. Twitch had everything working for him. The way Ellen before the dance, he go play music, people Ellen go dance, dance, dance. He was always happy on the show. Always happy on the show. The Twitch, leave the house, go for some motel. He go kill himself for it. He never even spoke to anybody. He never dealt with what he was going through. He killed himself. Twitch died. I'm telling you guys, all this is coming back to depression. Twitch had wife, he had kids, he had everything working for him. Guess what? He left his house, he left his wife, went to a motel, killed himself. He was a DJ for Ellen DeGeneres' show. He was a DJ. Yes. See Kate Spade. Not be to know to see who Kate Spade I'm back. Yeah, just based with the whole Kate Spade. Kate Spade is a renowned designer. She killed herself. Ah, Kate Spade killed herself. Look at these people. We need to take care of our mental health. We need to take care of our mental health. Just like we take care of our physical health, we also need to take care of our mental health. It's very important. See, all of the people in the world don't listen. See, even Winnie Houston then. Winnie Houston became a drug addict. What pushed her into doing drugs? She died. The same drug that killed Winnie Houston killed her daughter, killed the daughter, her boyfriend. Look at it. Come on, welcome. Welcome, mommy. We need to take care of our mental health. Yeah. Twitch died so they play. The boy just come over kill himself. You don't want to say he shoots himself with gun. That kind of painful death. What was going? See, mental health there. We need to take care of our mental health. There was so much going on in his brain where he just decided I would just want to die. Yeah. They just died like that. Mental health is serious. Serious issues. We need to take care of ourselves. As we take care of our physical, we need to take care of our mental. As we take care of our physical, we need to take care of our mental. Like I said, we don't treat mental health illness, we manage your symptoms. It is not curable. You live with it for the rest of your life. Yeah. Your symptoms can make you feel normal and okay and stuff like that. But then something will come up that triggers your symptoms. Then you're back to normal. You're back to square one. You see, some person will say, "Oh, Miss, I've been taking my meds for like 10 years. I'm fine." Then my mom died, and everything just came back. That was a trigger. The death of her mom was a trigger. Now she has to start from scratch again. That 10 years, the medications and the therapy were keeping her stable. It not mean the disease, the illness did go away. It never did. It never went away. Yeah. At that moment, you the key yourself, if you say everyone be better off than you. Just that, yeah. You feel like the world is better without you. Sometimes we want to judge people that commit suicide. But sometimes but at the moment when they commit suicide, that is all that is in your brain. They didn't think about their picking them. They don't think because if you start thinking, they don't think. Their brain, that cloud, that darkness, don't eat them up with anything. Because sometimes we say, oh, people that kill themselves are very selfish. They don't think about their family members. They don't think about their loved ones. You get to read picking and you go die. Why? At that point, the only two way for your mind is say you want die. They have to take you out of that place. There has to be some serious intervention to take you out of that dark corner that you already did. Yeah, there has to be serious intervention to take you out of that dark place. When you reach for the point where you want to kill yourself, it takes a lot of intervention to get you out of that darkness. Yeah. When you start thinking, say, these people will be better off than without me, oh my God. There has to be a lot of intervention to get you out. Yeah. We all need therapists. We all need our counselors. We need somebody. Yeah. If your friend is a friend that you can trust and you know your business, she'll keep your business private. If she is somebody that can counsel you, talk to them. You see, feelings of suicide, it comes and goes. Every now and then it comes for your head. How you manage them, now for the way it matter. Oh yeah. No man know the way if you say, oh, never thought. Sometimes those the thoughts they come. If you don't have a strong willpower, you don't have a good coping skill, you don't have a purpose for this life. When those thoughts come, you're gonna act on them without thinking. Yeah, you're gonna act on them without thinking. I move the glasses to rest my eyes first. Aye, God, Mama mia. You act on them without thinking. Yeah, just be very important. Put your therapist on standby. Call them. Say, hey, I'm in a dark corner. I'm thinking about, stuff like this. I'm having negative thoughts. Yeah, those thoughts have come back. I'm thinking things that I shouldn't be thinking. It disturbs me. They'll talk you out of it. Yeah. And then the next day you go about your business. But imagine that you're having those thoughts, you're thinking those negative thoughts. Then you don't have nobody to talk to. You don't have nowhere to go. You don't have no purpose in this life. What are you going to do? That's when you see, you act on those thoughts. You act on them. Yeah. You will act on them. Yeah. Yeah. You act on them. So your circle, create your environment, create your circle, be around people that you can trust, that you know they have your back. Have people that when you start thinking bad things in the middle of the night, you can call them and they talk you out of it. Even that one man get out of your life. Even that one person get out of your life. Yeah. When sleepless night hits you, when insomnia hits you, then you don't have anybody to talk to. Then you start thinking things. You have to have one person who if you call and say, Bo, how? And if you sleep. When I talk, just talk. Yeah. Just talk. Yeah. You need that one person for your life. You need some person where you know say, even if you call in about 3 a.m. for morning time, he go pick his phone. You need one person for your life like that. When you see a call, ignore them. Because at that time you need that person. And whether you call them for that night, you need to call them and say me una kungusa. No. You calling them because there's something going on in your mind that you need that distraction. You have to have somebody like that. Una see, I don't feel read comments again without this mirror. Ah, where I face. Exactly. Just that you need that one person. I know, right? We're always there for the for people, but so Baru, remember no? I know, remember I saw you now. You told me. Yeah, yeah, Baru, I remember. You remember when you went? I think you were in medical school. You went to Guam or something at the time. Yeah, you told me. See, you're very right. Managing with medications only. I spent 1 month in a mental health hospital while I was in school. I remember. Baru, I remember. Now I'm on medication every day and I see my psychiatrist every 3 months. Yeah, yeah. I understand. I'm very well. We're always there for others. Ah, Krista. No, depression is a worldwide problem. It is a worldwide problem. Not the only bush. But you know one thing is in Africa, a lot of people are depressed, but they don't even know it. The only thing difference with us here is because when you're depressed, you know it's depression because you know the signs and symptoms. You know something is not right. But you see, Cameroon, so you can be depressed and don't even know you're depressed. Some people don't even know what is depression in Cameroon. They don't know. It is a worldwide thing. People suffer with depression in Africa a lot. But in Cameroon, self, they don't even have means. There's no support. There's no treatment centers. They don't even have places to go. So they just deal with it the way they feel. You see, I know they just manage on them like some people have this laissez-faire attitude. Like Master, it just be go, it go make job be day. They learn to deal with it on their own because we don't even have resources to help people. We don't have resources to help. Then the way mental illness is stigmatized in Cameroon, in Africa, people don't even want to talk about it. You know how they look people the way they get mental health, mental illness for Africa. Think about it. People don't even want to talk about it. They don't. People because you already know how the society will look at you. So you just shut up and say, let me just deal with it the best way I can. Yeah. You can even tell people, now yes, Susan say, you can even tell people that you have depression or just they laugh. Someone will brush you off now. For Cameroon, if someone can tell you, say, get depression, where you still know about trouble, we don't know anything, it doesn't matter, come over here, go find one more to drink, now hungry, they surely do you. Yeah, that's how they brush people off in Cameroon. Somebody tells you, boy, I know they fine, no, and I need to say, master, and I'm hungry. Or go drink one man, go take one man for off license, you'll be okay. That's how we do. That's how they do. We know how to dismiss people when it comes to mental health in Cameroon. We're very dismissal. We don't even attend to that kind of conversation. We don't. We don't even give them listening ears. We don't. We don't even open up and even talk about that. That's the worst part. We don't even welcome the idea. We don't even give opportunity to talk about that. I should just bring up somebody just come over here. People they talk about better things. You can't talk about say you be depressed or you go through so master. Now you be first man. Go first for that side. That is what we do. That's what we do. We dismiss them. We grow up not knowing that we need to express our emotions. If you're from Cameroon, Africa in general, we grew up knowing your emotions, you keep them to yourself. You don't express them to nobody. Who get time for listening to you first of all? Because everybody has their own shit to deal with. They don't have time to listen to you. That's the society we're from. So people deal with depression. Some people are very depressed. They don't even know what it's called. They'll just list the symptoms. You will you know now you will understand. Say the man be depressed. But the person doesn't even know you what is going on. See. Yeah. I saw a friend going down and the husband was busy calling her a sadist. See? She was probably sad, lonely. She was feeling lonely. Instead for the husband would be supportive for the girl, it is to say the woman is sadist. But the woman is going through some stuff. You know, yeah. See, you see what I'm talking about? Oh yeah, we know how to brush stuff. You tell someone to be depressed. Hey, Cameroon. Yes, I say. So if you get so you be fine, get so you get money, you get all these things. What's the pressure come out? How can I leave man that too? That's what I'm about to worry. When I'm about to just the worry place. If you see depression, you know. That's what they ever talk. Say they show you depression, you know. You didn't see that man the way they don't get chop or chop. Now then get to the bit depressed, not be you. Ah, God. Can you imagine? Who dare you send a poor people get to be depressed? Onama will not get to be depressed. Everybody. Depression, the whole all man, rich, poor, blind, seeing, cripple, walking, everybody. See? Yeah. You start feeling guilty for nothing. And that guilty is still worsening your depression. Because that is what we grew up. Yeah, family don't make come on. Ah, my God. Say, oh auntie, I'm depressed. Yes, if it sounds safe. Yes, it sounds. You go to your auntie. Hey auntie, I'm so depressed. I'm going through some depression. They don't holler you eh. They say drive you and drive. Must come over here. Like you need to stay them. They don't even give you room. They don't even ask you, say, where, mommy, you seem a bit depressed. What to make you feel like you're a bit depressed? Come talk to me. Let's talk. What you go through. Let me listen to you. I feel help. No, we don't do that. We'll brush you off. Yeah. Yeah. They will brush you off. Yeah. They'll tell you, say, master, come out for you. You know depression. If you see depression, you know. Those are the people. They'll even show you my Camera funny. Doesn't a man get to be depressed? Not be you. Can you imagine? They're choosing somebody. Don't talk am. Say no, 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 the man I get to be depressed. Not be you. You will have everything going for you. Say come on depression. Never talk that kind of thing again, Mr. Maye. Yes, that's the like saying a taboo. Oh, it is. Don't say no talk that kind of thing. No ever talk am. Me that kind of talk no come off your mouth. You see that picking over there? Now if you be depressed, not be you. Never talk that kind of talk. Who say they be in depression before? Hey. My people. They say my people die because of lack of knowledge. Ah, yeah, it's because we're not informed. So it's because we're not informed. For real. People are not informed. People are not educated about mental health stuff. We're not informed. People don't even know the signs. You get paid, if you get some person for house where you go through depression, you don't even know the person is depressed. So you cannot support somebody going through something you don't even know. When you see just then you see what I talk no. Don't tell you. Say that man get to depressed no be. Ah, my people. Yeah. They say my people die because of lack of knowledge. For real. Africans, Cameroonians, we need to be aware of mental illness. We need to be aware. We need to be educated on mental illness. We do. We need serious interventions in that country, Cameroon. We need serious education. We need to create awareness in Cameroon. We need to create awareness. We're going to talk about drug addiction. Maybe let me see if I can contact this my girl and see if she can be available tomorrow. I really want her to come in. She's an addiction specialist. I started with depression because I know it affects a lot of us. A lot of us suffer from depression. Next, we're going to talk about drug abuse, drug dependence, drug addiction in Cameroon. That's another thing. It's like a pandemic. But I want a specialist to come in so we can talk about it. Yeah, she deals with that stuff every day. She's been doing it for a while, so she knows. Yeah, yep, exactly, exactly. Talk to your kids. We'll talk about mental health, how it affects kids. We'll talk about how family issues affect kids. We need to communicate, right? Just babes, we need to communicate with the kids. Yeah, talk to them. Be open to them. Be open to them. Oh, yes. We need to start talking about this stuff. The more we talk, the more we create awareness. You understand? The more we talk, the more we create awareness. The more we talk, the more we reduce the stigma that is associated with mental illness. The more we talk about that, the more we create awareness. If we don't talk, how will people know? How will people learn? How will people be educated? We need to talk. Substance abuse is a pandemic in Cameroon. I don't even want to talk about America here. America, they like water. But see the way it destroys people in Cameroon, Africa in general. Look at what drug addiction is doing to people there. We'll do another live show tomorrow. I want us to talk about substance abuse because the substance abuse, right? It comes from depression. A lot of things, a lot of stuff that goes on with us, right? It is stemmed from depression. Depression, they're like the root. Then there's branches. When they're not like trees, we don't plant up a ground, right? Then different things they develop, different things they come out for the thing. Yeah, depression is like the root, then branches. They did it exactly. Drug, drugs. People use it to self-medicate. They covered your pain, so we have to talk about it. We'll talk about addiction, length, lengthy. We'll talk about rehab, rehabilitation. Cameroon, we don't have resources. Like the way I'll talk about addiction is going to be more like in the Western world because I don't be here for a long time. I don't work in these places. But Cameroon, we don't even have resources. When people go in and come out, what resources are in place to help them? Yeah, that's what it is. Drug abuse is numbing the pain. That's what it is. You are numbing the pain. You self medicating. That's what it is. So we're going to touch that one more. Then we're going to come to bipolar. We're going to talk about post traumatic stress disorder. We're going to talk about psychosis. We're going to talk about schizophrenia. You guys know those people that sometimes, I don't want to use the term, some kind of term. You know how sometimes they say, oh, this man, the mad, this man, the mad. There's a diagnosis for that that we don't even know. Cameroon, we don't even know. We treat people with mental health issues like, how to even put that name? Like they don't get to they exist. Because that's the truth. We treat people with mental health issues like they're not supposed to exist at all. Society, they just put you for some corner way. Oh my God. Yeah. Society treats you like you don't belong. Like it's some kind of evil, demonic thing you're going through. Yeah. It's like you going through some spiritual shit. Oh yeah. Hyper religious. Hyper religious is schizophrenia. Just babes, yeah. Schizophrenia people, they have hyper, they feel, some of them feel like they be God. They feel like they be Jesus. Yeah, a lot of people with schizophrenia, they hyper religious. Hmm. They hyper religious. So we're going to talk about stuff like that. We have people that struggles with bipolar issue every day. So that this TikTok where you tag me though, that Chacha Fanny, that girl, yeah, she I remember she has bipolar. Oh, wait, I don't do my camera. Yeah, she has left her husband like three times coming. Her husband will say one day she woke up and a woman stand in front of mirror, don't broke the mirror. He will ask the woman, say, what did it happen? The woman says there are some people coming out of the mirror, they're seeing things. Yeah, we have different stuff. There's depression with psychotic features. Depression that you don't get for some stage where you decide to see things and hear things and do things that other people don't hear or see. Yeah, depression with psychotic features, with psychosis. They have people dealing with schizophrenia in Cameroon. But they just look and say, Master, I didn't mind him, man. When I take it, go Bombay. Some place you there for that Moyoka side. Na Barombi, na Bombay. Where they be tight. Cameroon is the worst. Cameroon is the worst when it comes to mental health. They beat you, say they want to move that craziness out of your head. Are you kidding me? Those kind of kick way that. See, they get to don't change you. There's a place, I don't know whether na Bombay, no. Na Bombay, they keep crazy people, they would eat. Oh, yeah, Crystal, when we talk about addiction, it's going to be mostly especially for us here and the kids, yeah, it's gonna be yeah, we're gonna talk about stuff like that. Yeah, because a lot of kids here are going through some stuff. A lot of parents are going through stuff with your kids because of substance abuse. Addiction is rampant among kids in America. This was more begin there. Ah, my God, they do hardcore drugs. They do hardcore drugs. I work in the state of Arizona. There's a fentanyl pandemic. Ah, my God. One mommy lost his two picking them, his son and his daughter, for accidental overdose on fentanyl. Two picking them, and those were the only two kids she had. Tell me, isn't that automatic depression? See, life changes will make you depressed. Medication will make you depressed. Genetics will make you depressed. Psychological issues will make you depressed. A lot of food, all things will make you depressed. So this should become like normal conversation in a community. It not get to be as until we it be stigmatized, you the fear for talk up. No, it should be like having a regular conversation with your friends. Yeah. The pandemic for drug abuse in the Western world, eh? My God. Especially with kids. Kids from good, well-to-do family. Yes. Kaji Ben White say you need to watch the entire video later. Yeah. There's depression that comes to psychosis. I took care of a little girl when I was doing psych, inpatient psych. She was from Congo. She was French. Me too. I don't come to na. Oh my own, this way from Cameroon. You from Cameroon, you know, French. I got brocata to my. So when she heard that, I just even know a little bit of French. If I know that girl, I was the only one that could take care of her. First of all, no man of you understand it. He's speaking only French. You don't know no English. She had postpartum depression that led to postpartum psychosis. Ah, I see how. Oh my God! But you know the good thing, he was her pastor. That's why I respect some pastors because when they were saying a demon made a pray for you, her pastor was the one that brought her to the psych hospital. Yeah, her husband took her to the pastor. You know, some people don't believe in mental health issues. Say, oh, she's possessed. Hey, she don't want to take care of the baby. She sees the baby, she wants to throw the baby. She wants to do this. It is postpartum depression. Hers just led to psychosis, where she started being delusional and paranoia. And paranoid. She started thinking like her husband wanted to kill her. Her husband is having an affair. Her husband is doing this. She still had the baby. Her husband is doing this. psychosis. She became delusional. She became paranoid. Her husband took her to the pastor. Do you know who brought her inpatient? The pastor for their church. Now he bring that girl to hospital because he knew that this was not spiritual, like the husband said. He knew that this was a mental issue. The husband brought her to church. I mean, to the hospital. The husband took her to church. The pastor took her to the hospital. Yes. I mean, look that girl say, "Dele ma cry." I mean, look, dele say ma cry. When she came in, she was very psychotic. Ah, my God. He need to look for say one cash. I say, where mommy? Not to know day for day, no. Where? Ah, then nobody could understand her. I said, luckily. Say what my coworker they said, oh, Miss White from Cameroon. She always say they speak French and English. At one point, I worked 7 days straight because of that pikin. Because if I know they work, nobody do nothing. If no man of it okay, if I know they work, nobody can do anything for her. And I'm the one in the night. So during the daytime, they even come away for a room. That next day, Jogo tapi, the test they get medicine. They said, no, 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 j'attends Miss Paye, j'attends it. Because they don't know English. And guess what? Now, it matter bring it from Congo. You know, be there even stay America. Ah! You should not get a story, no. I know if I what are the come on my eye when I think about that? It matter bring it for Congo. You don't come America. It never even stay for long. It carry belly. It born. Now whether the man be the feel say because the woman just come na spiritual attack say oh if people they not be one may travel they don't do this thing no 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 now pastor bring him hospital. Oh yeah, a lot of people run on struggle, but the thing that happened to that girl, she never like I said, we will not cure you, we will manage your symptoms. If I not there, that girl, no man. As soon as he see me so, if face you can if face just because if say no say no man of you understand me. He go tell me say Miss Mom baby. Small pikin don't leave him. For a matter. He don't only cry say one go house. I'll tell this Miss Fufu, I go broke my own French. I go broke my French to the best of my ability. I said, Mommy, you know if you go house now. Now for French I dey talk to me. So I don't come back Cameroon 20 years ago. Me and French, you get friend. Hmm. I go struggle so say, baby, they understand me though. I'll tell you, say no go house. You know well. He said, but you just get picky, wait till they happen. Ah, when I never even know. So the man don't see him working for inpatient psych hospital. No me. I talk about that girl, my eye already wet. I did think I did just mentioned the girl. My eye already wet. That first time when that girl came, do you know how many other times she came? She never, ever be the same. Yeah. Because too, anytime we give makes where can we go there for where go out to matter the stop her. The husband not be believe in mental health issues. The husband never believed in those meds that were giving her. But those were the things that were helping her. I think at some point they finally just carry go back to Africa. Yeah, they say they want to take you go country fashion. Oh yeah. So Kaji, I know. Yeah. Yeah, so that girl, that Chacha we talk about. So Chacha is a Nigerian actress. She suffers a lot. She said her mental health issues. Oh my God, she was doing a show. She was talking about what she's been through. Yep, she has psychosis. It's affecting her a lot. People around us have bipolar. A lot of people, our friends, they struggle. They struggle with bipolar. Yeah, people struggle with PTSD. People struggle with PTSD, post traumatic stress disorder. We're going to talk about that one. We need a whole show just for that one. And when I talk about that one, a lot of una go on the where when I talk about PTSD, a lot of una understand say you guys have it, they don't even know. Yeah, a lot of people go have it. Post traumatic stress disorder. Just like it's ide, just a post traumatic stress disorder. Trauma will come after you don't be exposed to a stressful event for your life. Yeah. You see always so. Now so we just need something to trigger us. That's all. We just need something to trigger us before everything starts coming around, flying all over the place. Yeah. Who are you telling? Who are you telling? Have you talking about the radio show? 95% of Cameroonians suffer from post traumatic stress disorder. If you're from Cameroon, you were born in Cameroon, there has been a traumatic event in your life. And we don't never seek therapy. We don't do counseling. Yeah. We have it that has never been resolved. Yeah. Unresolved. There's also unresolved childhood trauma. A lot of people struggle with it. A lot of people struggle with unresolved childhood trauma. They've been through some shit that we never handle. They never spoke to anybody. Yeah. All we so all we were the verge. We're just looking for the listing to set us up. Well, my people, we're gonna do this. I don't know, Rita. Most Cameroonians, most 95% of us struggles with PTSD, post traumatic stress disorder. We do. We've seen some shit. You see that accident, the way they used to happen for Joanna Road, so where you pass, you see cops, they don't lie down, over down. That is trauma. It is. It's traumatizing to people. But I say, we will never, you be Cameroon, you don't even know any better. You don't even know how that will affect you or how it is affecting you. You don't even know it. Yeah, exactly. See how people they respond sometimes they will see happen. The way some people respond to stuff, you can tell they're going through some shit. They don't even need to tell you. Some people take their anger, eh? You post something where they don't like them, eh? They like they will die and die. You can pick them up. Like this one, so this is what it is. I can diagnose you from just the way you comment sometime and post some shit on Facebook. I just know you're going through some shit. Hmm. Yeah, we have a lot of issues, a lot of mental health issues that we don't talk about, we never dealt with. It's eating us up. We need to make this place a safe space where we can talk about stuff like this. People can talk about their experiences and heal. People can think about their own stuff even if they don't want to talk about it. They can listen to us and heal. They can be like, oh, this person go through the same thing and do how it manages so and so it day. I don't deal with that. So we need to create an awareness. We need to start talking about stuff like this. It's very important in our community to start talking about stuff like this. We need to create awareness. The knowledge is there. We just have to pass it through to other people. I know, right? Yeah. The way some people react, only what he Facebook, so what did he? The way some people react, I just look at her and say, Some of them need anger management therapy. Yeah, anger. You see how people get angry? It's a mental health issue that need therapy, counseling, anger management therapy. Yeah, the way some people be acting sometimes. You the one that say, not only for this small post where the man they react to. Hey God, you don't know what that person is going through. Maybe that's the outlet too for them to to release some emotions. So we shouldn't be judging them. We shouldn't be judging them. After today, we should learn not to judge people, right? We should learn to create safe space for people, right? We should learn to be supportive for people to talk to us, right? And we should also learn to seek help. We should learn to seek help. We should not die in silence. We should not die in silence. Don't be buried in that dark corner. There's help out there. You have specialists. You have people that are willing to help you. Seek help from professionals. You understand? Seek help from professionals. Oh, wait, my glasses back. Yeah, yeah. Rita, only the way you described that one, so I'm already traumatized. Exactly, exactly, Kaji. We have to be open. I just feel like after this conversation, that's why I'm bring. I start. I say, man, start do this thing because I want people to be able to open up. I want people to be able to talk about stuff that they go through. That's why we're having this conversation. Our community they suffer. This is just to create awareness. It's not the end of the life when you suffer with mental health issues. It's not a death sentence. It's not. These should be normal things we talk about. You should be able to call your friend and say, "Hey, Bo, now the thing is what they go through. What do you think? Or if you get some person who I feel call it, talk to them, tell me. You should be free. You should be open." I know, right? I know. Thank you. Thank you for coming. Thank you for coming over here. Yes. Woo, Jolie Babe, thank for Jolie Just Babe, thank you for your contribution. It meant a lot. Thank you for your participation. Yeah. We have to be open. We need to speak up. Some person go deal with it, go watch only the one. He say, oh, that means this in a normal to a future talk about them, right? Yes, it is. Don't let this stuff eat you up. Be free. Free yourself from that burden where you carry on. It's not the end of the world. We when I was on Toride the last time, we are talking about spirituality. Is it spiritual attack or is mental illness? You when I know so we come up Cameroon, right? We're brainwashed because there's some stuff that is mental, but we don't decide all man is facing as spiritual, but it's not. And if you go to a preacher that does not know any better, that cannot differentiate between mental health, mental illness, and spiritual attack, you will suffer. You will suffer. You want to say why they don't pray for them and say not any help? Because prayers is not what they need. They need medical intervention. We have to be able to differentiate. If some person come for you as a preacher, say, hey, I'm going through this stuff. How you will do differentiate them? Do you have any knowledge of mental health? How can you be able to say, oh, my sister, this one will be spiritual attack or this one a mental illness? Let me direct you to the right people. Do you have that capability to be able to send people to the right direction? Do you even know how to counsel people? That will be for another day. Yeah, I want people to suffer. People to suffer. Yeah, schizophrenia they ever be mistaken for spiritual attack. Schizophrenia, because when schizophrenia, right? He has psychosis. When a person is start sitting, then the yet then they tell now, I say, hey, my village people don't kill them. Oh, when I come go pray for you. Prayer is not what they need. They need help. That is a mental illness. It's not spiritual attack. Not everything that happens is spiritual. Now that's in the Kiwi for Cameroon. That's why people don't talk about mental health stuff. Now that's in the Kiwi for Cameroon. Because they don't know how to differentiate between mental illness and spiritual attacks. We don't. They don't. Even that pastor where you go for it, so they pray for you, say, he didn't even know what to pray for you for. He did pray for you for waiting. He did pray for you, so waiting. So may stop for the ear voices. Or may stop for the sitting the way you know they. He didn't be able to differentiate because you don't know the difference. You have to pick the people that pray for you. You have to. You don't know it. So man go try to say, I'll cast the demon out of you, cast the demon out of you. Oh, Sharaka Babarosh, ah, the demon they leave. When I think, don't pray for 1 month or 1 year, nothing may change. That person need help. The mental illness, not the spiritual attack. Yeah, they need appropriate medical intervention to help them. You guys can be praying at home. They send them somewhere, let them go get help. If wherever they are, there's a mental health hospital, they send them there. Send them there. Just based, if I read the thing that some dog can't do attack na me and you. Yeah, send them to the right places. Some people are versed. They know about mental health. I don't tell her. So that girl, she had a psychotic breakdown. It must have taken up for pastor. Pastor, bring it for psych hospital. Pastor, bring it for psychiatric hospital. Because the pastor realized and say, this one not be spiritual. It's a mental health issue. Does your pastor know how to differentiate both? Can your pastor advise you like that? Or you know what may feel say, be prayerful enough, be spiritual enough, you go try to pray for you, may not feel like say be disappointed. It's a disappointment. Nah. Yeah, because some pastors they need one media members, they feel like say they don't know what to go do. Even some of those suspects they get mental health issues. They'll say, no, my sister, let's pray for you. Ashoroko babaraka sharaka babaraka shoroko shoroki. They speak in tongues. These are stuff that need medical issues. Yeah. There's stuff that is spiritual, we know. There is stuff that is mental. We should be able to put them two things aside. So the one that is spiritual, we pray to God to help. The one that is mental, we take them to a psych hospital to professionals to take care of them. Exactly. How you even know saying that voice with the year? So we really need to be careful. We need to create awareness for mental illness. We do. We as a community we suffer. Our people suffer. Our people suffer because of lack of knowledge. Not be then have a Bible. Now Bible talks to them. So my people suffer because of lack of knowledge. You didn't have a Bible. Yeah. How can we help people if we cannot create awareness? How can we help people if we have the knowledge that will not share them with them? How do you help people? How? How do you help people? How do you help your own community? If you know all this stuff, you have the knowledge, you've learned about this stuff. Do you know if you can break and down to them, make them to the understand them? How else is your service? How can you be serviceable to your people? How? Because at the same with people they holler. Hey, mental health, oh, mental health is something we need to talk about. Oh, Cameroonians will suffer with mental health, mental health. But they don't even want to go to places, right? Where they will learn. Those same people where they complain, oh. If you tell them, say, oh, go for this place, this person you talk about mental health, they don't even want to go there. That's what people they do. That's just how we are. That's what they do. But now we go be first people for run them up. Oh, why don't we have Cameroonians that talk about stuff like this? Why don't we people that are creating awareness? The people they day, but do you guys listen to them? Do you guys listen to them? No, you don't. So it makes people don't even want to talk. It makes people don't want to talk. They just sit down with their own corner. Yeah. So we have to create awareness. We have to be able to talk about stuff like this. We have to be open. If you have something going on, use yourself as an example and educate people. There's nothing wrong with that. People learn better when you use yourself as an example. People appreciate when you teach with examples. Your life experiences, people can learn from it. Because then the way you handle yourself to be who say you day to day, right? It will help the other person tomorrow. But a lot of us have gone through some stuff we don't even want to talk about it to the next person. You've already healed from it, right? You manage them well. You don't heal for them. Then you see other people that go through the same stuff. Don't you think it's your place to be the voice? Don't you feel like it's your place to be the voice? Maybe you were married at some point, your husband died. It traumatized you. You went through depression. Couple of years later, you don't deal with them. You don't move on. You're a better person now. You don't think so? If you use that voice to educate other people the way they don't go through the same stuff, you don't think so? We need to use our voice. Whatever experience we don't go through. When you see, I say your life, if you use yourself as an example for educate other people, then we have to. If you have knowledge, a lot of knowledge in certain things, where you notice a massive benefit them, use that knowledge and help people. Even if the one man, what's happen? At least you don't help some person. Even if the one man, you don't help some person. It be fulfilling. For nothing if you help people. Well, Carol, we talk about that already. We don't talk about stigma. We talk about stigma a whole lot. That's why we're creating awareness. That's why we're talking about this. So we take off that stigma that people have for mental illness. Yeah, that's why we're doing this. So we can destigmatize mental illness. That's why we're doing all this. We're talking, we're creating in the meantime so people can learn. In my phone to know if it just be one place. There you go. Ah, I don't move my glasses. I don't see. Yeah, we've talked. You're late, Mama. You need to watch the video all over. Yeah, we don't talk about stigma. That's why we have this platform. That's why we're able to talk about stuff. So people can feel like, hey, maybe I be look this mental health like saying as something, so no be something at all. Because say the people they be feel, say the people they be free. They're free to talk about it. People have given their examples in the comment section. They talk about their experiences. They talk about the stuff that they go through, that they went through. Yeah, a lot of people. So we'll continue tomorrow. Tomorrow we'll continue. Tomorrow we're talking about substance abuse, drugs. Tomorrow, that's what we're talking about. Parents, Western parents. We're talking about us tomorrow. And we'll talk about people in Cameroon. They mostly us. Parents, yeah. Kids dying from drug overdose. We'll talk about it tomorrow. Moiti, yes, you late. So thank you guys so much. Yes, Rita, tomorrow we're talking about drugs. Drugs tomorrow. That one says that's a 12-year-old picking the boy. 12, 12. You know, maybe they look 12-year-old picking for Cameroon. Come on, 12 year old, you be still small. But now 12-year-old begin to already get history of addiction. They already get history of addiction. 12, 11, 10. They already start smoke marijuana. They already give Guinness until it already start fry their brain. Well, ladies and gentlemen, we've come to the end of the show. I'll see you all tomorrow. It was nice having you guys around. It was nice having 11 sis. Which I say 11. 11 as in. I know. Oh, you mean as early as 11 years old? Oh, yes, it's very, very scary. Very. It's very scary. Yeah. I'll try to see if I can have Dr. Vivian Sona to come here. She's an addiction specialist. So she's just going to tell you guys her experience with the people that she sees, how drug is affecting them. So I'll tap her today, tell her say I want maybe make come tomorrow for the show. She can run the show. Yeah, I can put her on. She can run the show tomorrow. So we'll talk about it tomorrow. Okay? You guys have a wonderful day. Mwah. Don't leave that open. Don't leave that open. DJ, that's coming for you. Oh, wait to. Where I don't stop the one. Okay, and